My name is Kate Leung. I'm a hepatology nurse practitioner from Johns Hopkins, and I'll be talking today on drug-induced liver injury. It's my disclosures. So drug-induced liver injury, also known as DILI, so just as it sounds, is an adverse toxic drug reaction that results in liver injury. Both prescription and herbal and dietary supplements have been implicated as causes of DILI. So the average adult American receives more than 6 prescription medications per year, and there are thousands of prescription medications available in the United States, and more than 100,000 over-the-counter herbal and dietary supplements that can be purchased in-store and online. So DILI is the most common cause of acute liver failure and is a leading reason for regulatory actions regarding drugs in development as well as those in the marketplace. DILI occurs uncommonly with estimated 14 to 19 cases per 100,000 and 60,000 cases per year in the United States. The most common culprits are acetaminophen, which we obviously know is dose-related, anti-tubercular drugs, antibiotics, and increasing cases of herbal and dietary supplements. So patients with pre-existing liver disease are at increased risk of developing liver injury, and they are also at increased risk of poor outcomes with a DILI episode. So there are several molecular mechanisms involved in DILI, including mitochondrial dysfunction, increased reactive oxygen species formation, depletion of ATP, increased apoptosis and necrosis, altered bile acid homeostasis and bile duct injuries, and as a result, cell death. So DILI can be classified into 3 groups, including direct or intrinsic, idiosyncratic, and immune-mediated or indirect. Direct hepatotoxicity is common, it's largely dose-dependent, it's predictable, and it's rapid in latency. An example of this is acetaminophen, which again can lead to liver injury after a certain threshold dose. Idiosyncratic hepatotoxicity in comparison is rare, it's largely dose independent, it's unpredictable, and has a variable latency. So though idiosyncratic DILI is rare, it accounts for 10 to 15% of acute liver failure in the United States. It lacks a clear dose dependence, yet recent studies suggest a minimum of 50 to 100 milligrams per day of the offending drug is required. The pattern of liver injury can be divided into hepatocellular, cholestatic, or mixed based on the liver enzymes, as we just heard. It can further be classified into immune-mediated or allergic and non-immune-mediated reactions. Immune-mediated presents within 1 to 6 weeks of drug administration, and this can be characterized by fever, rash, eosinophilia, presence of autoantibodies, and in severe cases, Stevens-Johnson syndrome. Minocycline and nitrofurantoin are well-established drugs known to cause drug-induced autoimmune hepatitis. And hepatocellular injury combined with jaundice have the worst outcomes. So typically, DILI appears within 6 months of starting a new medication, although certain drugs have longer latency periods. In contrast, hypersensitivity reactions can have very short latency periods of only 24 to 72 hours. Although DILI is often attributed to repeated exposure to an oral agent, it is important to recognize that exposure to an IV agent may also cause DILI. Topical formulations of the skin, eyes, or ears rarely, if ever, cause DILI because of the low dose of medication absorbed. So just some common offending agents. Of course, we know, again, acetaminophen, NSAIDs, Augmentin, and NIH are common, with Augmentin being the most frequently implicated individual agent in many Western countries, and anti-tuberculosis agents more dominant in Asian countries. Anti-neoplastics to think about are methotrexate. We know that oral methotrexate in long-term use can lead to drug-induced liver injury. And then keep in mind things like immune checkpoint inhibitors, which we are seeing used much more commonly now in cancer patients. And so these can lead to drug-induced liver injury in both single agent use as well as combination. So herbal and dietary supplements are widely used. These products often contain multiple ingredients. 20% of all cases of liver injury are due to herbal and dietary supplements. Ashwagandha is a common one that we hear about these days. And so we see an onset of 2 to 12 weeks. They can have a cholestatic or mixed pattern and present with jaundice and pruritus. The first case of ashwagandha was reported in 2017, and there's been an increased number since that time. So it is recommended that re-challenge with this supplement should be avoided. So a detailed medical history, including the use of those herbal and dietary products, is critical in all suspected DILI cases. This information should again include start and stop dates within the last 6 months. Have there been any dose changes, and when? Was there prior use of this medication, and was it potentially discontinued at one time? And so what was the clinical course following that? And then was it restarted, and what was the response to the re-exposure? So clinical features can range from somebody who is asymptomatic, just has elevated liver enzymes, or patients can present with fatigue, nausea, anorexia, jaundice. You can have dark urine and pruritus. Fulminant hepatic failure is rare, but however serious. And again, symptoms usually occur days to months after exposure. So DILI is largely a clinical diagnosis of exclusion. So relying on a detailed medical history, again, the pattern and course of liver biochemistry test, and excluding other liver diseases. So clinically significant DILI is defined as any one of the following. So serum AST or ALT greater than 5 times the upper limit of normal, or an alk phos greater than 2 times the upper limit of normal on 2 separate occasions. A total serum bilirubin greater than 2.5, along with the elevated AST, ALT, or alk phos, or an INR with an elevated AST, ALT, or alk phos. So this is a nice algorithm per AASLD guidelines for drug-induced liver injury. We've already talked about the first 2 boxes there. But in general, the pattern of injury can be categorized as primary hepatocellular, cholestatic, or mixed. And these patterns can be more precisely and quantitatively expressed through the R value. So it is recommended that you calculate an R value. An R value greater than 5 identifies cases of hepatocellular liver injury, and an R value less than 2, looking at more of a cholestatic liver injury. And then those between 2 and 5 reflect that mixed pattern. So all patients with suspected DILI, again, should be need to exclude other things. So you should be checking viral hepatitis panel. They should undergo screening for autoimmune diseases with autoimmune antibodies, IgG. And then all patients should undergo some type of liver imaging. So typically starting with that ultrasound and then progressing to an MRI or a CT if there is concern for vascular abnormalities or biliary disease. A liver biopsy is not necessary to diagnose DILI, but it can be useful when the liver enzymes or symptoms do not improve with drug discontinuation, or if the patient remains jaundiced, because it can help to assess the severity of the liver injury. So there are several clinical models that have been developed to assess the likelihood that a drug or herbal dietary supplement is causing a liver injury. And so by reviewing timing, laboratory, and clinical features, a scoring system is then applied and can give you a causality score that ranges from definite or highly probable to excluded or unlikely. There's currently a lack of consensus in the literature regarding which method of assessment is superior. And despite these tools, most cases of DILI are diagnosed by excluding other causes. So discontinuation of the suspect drug, along with supportive care, with things like antiemetics, antipyretics, and hydration are really the mainstay of management. You want to continue to monitor liver function. There are specific antidotes such as NAC. And then if you have severe cases, you certainly want to consider referral for liver transplant. Rechallenge with the suspect drug should generally be avoided unless there's an anticipated benefit is high for a severe or life-threatening condition. So N-acetylcysteine, as we know, can be used in acetaminophen overdose. Given IV or orally, can prevent liver injury if given within 12 hours of ingestion. But it is also recommended for patients presenting later. And there is a short course of IV NAC that may be of benefit in hospitalized adults with DILI-related acute liver failure that is non-acetaminophen related. So most cases resolve after drug withdrawal. Chronic DILI is rare but can occur, and this is defined as persistent elevation in serum liver biochemistries or the presence of radiological or histological evidence of ongoing liver injury for 6 to 12 months. So some examples of this could be hepatic steatosis from tamoxifen, NRH from azathioprine or oxaliplatin, and this can lead to things like portal hypertension during long-term follow-up. So for prevention and monitoring, we want to avoid polypharmacy when when possible. There needs to be regular monitoring of liver enzymes and LFTs if patients are on high-risk medications. Patient education is extremely important so that they are reporting symptoms early. And there are new DILI biomarkers in development, so we'll stay tuned for those. So in summary, DILI is a major and often preventable cause of liver injury. Early recognition and discontinuation of the culprit drug are key. Most people do recover fully, but some will progress, and judicious prescribing and monitoring are, of course, essential. So there is a DILI registry, drug-induced liver injury network sponsored by NIH. So if you have any patients who you think have a suspected DILI and they would be interested in participating, you can register them online. And then if you aren't already using LiverTox, this is an AASLD guideline recommended website, which includes a synopsis of the published literature on liver injury. It contains thousands of prescription drugs and a lot of dietary supplements. So this is a great tool to use in clinic. If there's medications that you're not quite sure, if there's been any cases of liver injury, this is a great tool to use. Thank you.